Hello and welcome to Living Healthier Simplified with Nurse Coach Zahra. How are you doing? How have you been? How are you and your family? I am doing great. I have been great. It's been an amazing journey for me as well. I am thankful to God. I wanted to go over a video that we released recently that have benefited many. I have had many contact me about that video that they have been suffering from stomach aches and really were misdiagnosed or were not diagnosed properly as a result. And once they watched that video and went back to see their provider, asked for that test to be done, and it was that bacteria that was giving them all this pain, all the stomach ache they've had this whole time. So they have been benefited. They have benefited from the video. I have multiple people who have um, reached out as a result of that. So I am gonna attach the video here. Take the time and watch it. If you are having a stomach ache, and especially if you are from certain regions or you live in a community lifestyle type where you share a lot with siblings, family, community members, and or you are from certain areas where this bacteria is common. So ask your provider to perform this small test for you to be sure that it is not the cause of your stomach pain, right? And the earlier the detection, the better, because living longer with this bacteria can lead to a lot of complications, can lead to um, even cancer, stomach cancer, chronic gastritis as well. So take the time and watch the video. I hope you benefit from it and that you share to the maximum so that many people can benefit from the video as well. Have a healthy, wonderful day on purpose. Thank you. Nurse Coach Zahra from Living Healthier Simplified. Hello and welcome to Living Healthier Simplified. Today I wanted to address a topic, a bacteria that can infect the stomach lining. It's very common worldwide. Sometimes people can have it without knowing they have it because they're not showing symptoms, and other times symptoms can present themselves. So it presents as burning, stomach ache, bloating, nausea, loss of appetite, sometimes frequent burping, the feeling of fullness, and when it goes long, sometimes it can lead to weight loss. If left untreated, this can lead to gastritis, meaning an inflammation in the stomach lining, and can lead to peptic ulcers or increase the risk of stomach cancer. It can also lead to iron deficiency anemia in certain cases. So how is this bacteria? How is it spread? So it's spread usually with direct contact with the infected person. So basically hand to mouth, whether it's by sharing food or water or eating utensils or eating together. Sometimes it's also found in the food that are not cleaned very well, the water. Poor hand hygiene can increase the risk of this bacteria. Some of the ways that this bacteria can be diagnosed is through a breath test or a stool test, and it can also be detected through a blood test, but it's usually less accurate, so other methods are preferred, the first two methods. Lastly, through an endoscopy where a biopsy is obtained. This bacteria is known as H. pylori. So the usual treatment methods include, it's a combination of therapies. It's about 10 to 14 days. They could range from 2 antibiotics to kill the bacteria and proton pump inhibitors, also known as PPI, to help reduce the stomach acid. Just remember, if you are recovering from this, that your stomach might be sensitive at this time, that you might need to do lifestyle adjustments, meaning especially after you finish the antibiotic, you need to eat more probiotics to support your gut. Foods that are rich in antioxidants such as berries, the leafy green veggies, green tea, broccolis can also
broccoli sprout can also be beneficial. Remember to limit alcohol intake, smoking, or avoid basically alcohol, smoking, NSAIDs, aspirin during this time. So what are some of the ways we can help prevent this bacteria? Is through thorough hand washing. As you know, hand washing is the number one way of preventing infections. Drinking clean and safe water, good hygiene, good practice of washing the food properly, especially veggies that are naturally picked from farms. Making sure that these food are properly washed, or foods that are exposed to nature a lot, that are not cleaned prior to being brought into the selling areas. So being sure to clean the food very well, and avoiding sharing utensils with family members or people that might be infected also can help reduce the risk of getting H. pylori bacteria. Overall, it's very important to be a self-advocate in terms of our health, to know that our health is in our hands. So in case if we are experiencing these symptoms, please see your primary care can order these tests, or you can see a specialist. The GI specialist can also order these tests for you. So if you're having these symptoms, encourage your providers to do this test for you, just to make sure that this is eliminated out of the way. As I've seen in my experience, many people who skip this part and end up doing extensive tests and or suffer with this, or end up suffering from this longer than they were supposed to, because this was something that was kept. Or sometimes, especially if you are in certain communities where there's a lot of togetherness, there's a lot more people living together, eating together, so there is higher risk of getting this H. pylori bacteria. So if you are in a household where you see one family member has been tested positive and has been treated, so encourage other family members to do the same thing if they present symptoms. So overall, just be your self-advocate. Stay on the lookout. Remember, you are your first health advocate. You're responsible for your health. Have a healthy day on purpose.